Hello, and in this session of 3 to 5, we are going to discuss the chronic diseases aspect of the global health crisis. So the question, of course, is what are chronic diseases? Now, these are long-term medical conditions that are generally progressive. They're also known as non-communicable diseases, or NCDs. In other words, they're not passed from person to person like infectious diseases. And the four most common chronic diseases worldwide are cardiovascular disease, such as heart attacks and strokes, for example, cancer, chronic respiratory disease, and type 2 diabetes. Now, chronic diseases are the leading cause of death and disability worldwide. So they should obviously be taken very seriously. I'm sure you would agree. In fact, this is what the World Health Organization has to say about chronic diseases. And, this article on chronic diseases and health promotion is from its website. And the emphasis that you see in this article, in this presentation is actually my emphasis and not in the article itself. In any case, the article is entitled Integrated Chronic Disease Prevention and Control. And it states that chronic diseases are the leading causes of death and disability worldwide. Disease rates from these conditions are accelerating globally, advancing across every region and pervading all socioeconomic classes. Now, the World Health Report of 2002, entitled Reducing Risks, Promoting Healthy Life, indicates that the mortality, morbidity, and disability attributed to the major chronic diseases currently account for almost 60% of all deaths and 43% of the global burden of disease. And by 2020, their contribution is expected to rise to 73% of all deaths and 60% of the global burden of disease. And moreover, 79% of the deaths attributed to these diseases occur in the developing countries. Now, four of the most prominent chronic diseases, which are cardiovascular disease, like I said, cancer, chronic obstructive pulmonary disease, and type 2 diabetes, are linked by common and preventable biological risk factors, notably high blood pressure, high blood cholesterol, and overweight, and by related major behavioral risk factors, such as unhealthy diet, physical inactivity, and tobacco use. And action to prevent these major chronic diseases should focus on controlling these and other key risk factors in a well-integrated manner. Now, you can read this article if you want, at this URL. Okay, so it's clear that the burden of chronic diseases is rapidly increasing worldwide. And this graph depicts what the article mentions, as we've seen, namely that chronic diseases will contribute 60% to the global burden of disease in 2020 and will be the cause of 73% of all deaths around the world, in that year. And cardiovascular diseases are the cause of most deaths, really, from chronic disease. Now, South Africa is, of course, not immune to the chronic diseases catastrophe. In fact, according to a report published by the Chronic Diseases Initiative in Africa and the Burden of Disease Research Unit, it states that South Africans are getting unhealthier. We are fatter, less active, and at greater risk than ever for chronic diseases. And the report also states that South Africans are dying slowly of chronic disease. Now, I don't want to burden you with the statistics, of course, but the statistics are very concerning. And this is actually the report I'm referring to. And you can pause the video if you want to read, what the gist of this report is about. Okay, and on this gloomy note, I'll end this session. Thanks for your time.